So welcome everybody, and thank you for joining the webinar today, Reimagining Health Systems for People with Disabilities and the SDGs. My name is Hannah Kuper. I work with the Missing Billion Initiative, where I'm the lead on evidence and research. I'm also a professor of epidemiology at the London School of Hygiene and Tropical Medicine, where I'm the co-director of the International Centre for Evidence in Disability. Right.
Thank you. And I'm Frederic Seghers, here representing the Clinton Health Access Initiative, and I am currently supporting our global work on assistive technology and disability. And welcome all.
And we're joined today by a distinguished panel. We have Dr. Joy Phumaphi, who is the African Leaders for Malaria Alliance and Botswana's former Minister of Health. We've got Dr. Ola Alghaib, who's the Director for the UN Partnerships for the Rights of People with Disabilities and one of the co-founders of the Missing Billion Initiative. We've got Susannah Rodgers, who not only is she a Paralympian, but she's also the Technical Disability Advisor for the Foreign, Commonwealth and Development Office of the United Kingdom. And we've got Dr. Bernhard Braune, who's from the German Federal Ministry for Economic Cooperation and Development. So just a few housekeeping. So during the webinar, the videos and audios are going to be turned off for participants. So closed captioning is available. So if you see at the bottom of the Zoom there, it should be a CC button, which you can press to get the captioning. And at the end of this session, there's going to be a Q&A. So please, as you're coming up with questions, click on the Q&A feature, ask your questions, and remember to upvote each other's as we go along so we can have a lively discussion. This webinar is being recorded so that people know, and it will be available on the web afterwards. So today we're going to have some brief presentations. We're going to talk about the new report, which we're so excited about and has been such a lot of work in putting together. We're going to present the new evidence and vision that has come out of the report and what that means for a roadmap towards inclusive health by 2030. Then we're going to hear from our distinguished speakers who are going to give their own different perspectives on these issues and their responses, and we'll have a Q&A. So first, let's start with a short film. So I'm going to stop the share and hand over for this short film now. Sorry, Celeste, we're not hearing the sound.
Sorry about that.
Our challenges are many, from stigmatization to barriers of different forms.
There are 1 billion people with disabilities globally, or 15% of the world's population. New evidence from the Missing Billion Initiative shows that people with disabilities are more than twice as likely to die prematurely, leading to 10 to 20 years lower life expectancy. Women with disabilities are less likely to be screened for breast or cervical cancer. Children with disabilities are less likely to get their vaccinations. People with disabilities are less likely to be tested for or have knowledge on HIV. This evidence shows that health services are not being delivered with people with disabilities in mind. Facilities are often not accessible for those with a physical, sensory, psychosocial, or learning disability. Attitudes of doctors and staff can be unhelpful, leading to misdiagnosis or over-medicalization.
I've been living with this body for past 26 years. So I know my body better. It would be great if someone listens to my side of and sort of then negotiates and then creates a system out of it.
Healthcare is often extremely expensive for people with disabilities who can face extra care and extra costs, meaning people must make impossible choices. These gaps matter. People with disabilities are being denied their right to healthcare.
There is no proper policy that captures the inclusivity.
That value system is not there to involve us.
Global health goals will not be met without radical change. To put an end to such suffering and close this mortality gap, there needs to be an overhaul of the way health is funded and delivered. Health systems need to be reimagined. A new report from the Missing Billion Initiative brings new data and a new vision based on people's personal experiences. It highlights that people with disabilities need to be expected, accepted, and connected in the health system. Healthcare must be affordable and accessible, delivered by healthcare workers knowledgeable about disability. Health systems need inclusive policies, leadership, funding, and evidence. At a time of unprecedented change, global health must face up to helping everyone, everywhere. Inclusive health means everyone wins.
Okay. So thank you. And that film kind of highlights why this report is important and the basis of what we found. So stepping back a little bit, we had a first report on the missing billion, which looked at access to health services for 1 billion people with disabilities. And we launched that in 2019. In that, we highlighted that the 1 billion people with disabilities, on average, have greater healthcare needs and face greater challenges in accessing care. And as a result, on average, experience worse health outcomes. And we mapped that across the SDGs, and we showed with the data that was available that people with disabilities were more likely to experience diabetes, malnourishment, catastrophic health expenditure, HIV, serious illness, and that health system was often a cause for lower life expectancy. We put this report out as a way to start to improve awareness about this issue and to try and summarize the data available. And what we found was that there was an interest in people that they wanted to act, but didn't really know what to do. And so from that, we launched the Missing Billion Initiative in 2020. This is a systems change initiative, and the mission is to transform health systems to ensure better access and outcomes for people with disabilities. And all this work is in partnerships with health actors globally, like the report that we're launching today was in partnership with CHAI and other people. So starting with that basis of that first report, there were some key gaps. We didn't have enough data available to really show where the gaps were. And the other thing is it was setting the scene. It wasn't then going into what solutions might be. And so we've tried to address that with our new report, which we're starting to launch today. So this new report aims to provide a solution to this missing billion problem. We're presenting a refined data picture on health outcomes, a new vision for inclusive health, and a roadmap for health system leaders. And as I mentioned, this report is being produced as a partnership between the Missing Billion Initiative and CHAI, and we're very grateful for the funding from GIZ and also for FCDO, who funded towards the data analysis. So turning to the data analysis, what did we do? Well, we analysed one of the largest global health data sets that disaggregates health outcomes by disability, which is the mixed UNICEF dataset, including about 1 million children and 1 million adults across the world. We conducted new systematic reviews on mortality and COVID mortality and disability, as well as scoping reviews and modelling on life expectancy gaps. And we've created a data dashboard for disability and health, which I'll present in a minute so that everybody can go and find the data that they need. The most shocking statistic is that our systematic review showed that people with disabilities have a 2.4-fold higher mortality rate. And we see that across settings, impairment types, adults and children. It's very hard to grasp what a higher mortality rate means. And so we also did modeling to translate that into life expectancy. And it shows that on average, people with disabilities have a 10 to 20 year gap in life expectancy. They're dying 10 to 20 years earlier. And we found that through the modeling of data, but we also found that through examples of real studies, which are presented in this slide, showing that around the world, for different impairment types and different settings, people with disabilities are dying younger, and that we can all agree is unacceptable. We also looked at COVID. Now, here's a commonly used statistic, and we know that people with disabilities are more likely to die from COVID-19. Within the UK population, people with disabilities make up 16% of the population, but 59% of people who died were people with disabilities. And in our systematic review, we saw again and again that people with disabilities were more likely to die from COVID, particularly people with intellectual disabilities. Our analysis of the UNICEF mixed data shows, with very large data sets with comparable data, quite comprehensively that SDG 3 targets will not be achieved unless we start to focus on people with disabilities. Our analysis showed that children with disabilities were much more likely to have acute respiratory infections, fever and diarrhea, and much higher levels of stunting and wasting. Women with disabilities have lower coverage of modern contraceptives. Children with disabilities are less likely to have been vaccinated, and adults with disabilities on average have lower levels of knowledge, testing, and treatment adherence for HIV. And that modeling that we've introduced here shows that because of these failures of the HIV systems to include people with disabilities, that without a focus on disability, it will be challenging to reach UNAIDS 95 targets, as well as the SDG 3 targets. These issues are not going to go away. As we move from predominantly infectious diseases affecting people in low and middle income countries to chronic diseases, we will see the same patterns of people with disabilities being left behind. Our analyses show that people with disabilities are more likely to get cancer, including breast, cervical, and lung. Once they have cancer, they're less likely to be screened for breast and cervical cancer, and treatment outcomes are often worse. And we also see this for diabetes. We know that diabetes is more common among people with disabilities, but they're also more likely to have related and avoidable hospitalization. We've put this data together in a dashboard. So this shows the key health outcomes data for 37 countries, and we have the link there in the dashboard, and we're launching it now. And what it shows is you can start to find your data yourself. So if you look along the top tab, you can look at data globally, regionally, by country, and by gender, or you can compare a number of different countries. And what you can compare people with and without disabilities for is in terms of the analyses presented. So COVID-19 mortality, child development outcomes, childhood illness, sexual and reproductive health, HIV, malaria, and health insurance. So here is an example where you pick Algeria as an example, and the child development and nutrition outcomes. And you see that the children with disabilities are falling behind in the early child development index. So 36% of children with disabilities are achieving this compared to 77% of children without disabilities. They're less likely to have been breastfed, and they're more likely to have stunting. So I encourage you to go and have a look at that data and play online and find what's important for you. So this is a problem statement, and this is a real problem. There are 1 billion people with disabilities. They're being denied their right to healthcare, and this is an issue not just for individuals and human rights, but also in terms of achievement of health goals. So what do we do? Well, as introduced in the video, we need to reimagine a health system that is inclusive of people with disabilities. So to create this vision of an inclusive health system, we got inputs from more than 400 people with disabilities throughout the world through one-on-one interviews, online, workshop engagement, and through social media. And essentially what we asked people is, what does a better healthcare experience look like for them? We're very used to thinking about barriers. What are the problems? Why are people failing to access healthcare? But how can we switch that around, and what do people see as solutions? So as an illustration, imagine a woman with visual impairment and HIV living in South Africa. So instead of thinking of all the barriers that she faces along her healthcare seeking journey, let's think about solution. She gets a reminder for an upcoming visit on her phone. Her family supports her to access the public transport, and a health worker picks her up. The nurse doesn't have misconceptions that she's asexual, but actually asks about sexual activity and provides condom. The labels that she needs are in large print so that she can see them, and the nurse checks that she understands the information correctly and receives audio messages afterwards. So this is just an example for one woman in one setting. But if we start to build up these scenarios, we can build up a bigger picture of what an inclusive health system should look like. And this is distilled as a health system that accepts, and connects people with disabilities. So what do we mean by that? Through expected, it means that people must have a predictable healthcare experience. They know that if they go there, they're expected and they can get in the building and so on, and there's a system of care, that care is affordable. In terms of accepted, there is universally designed environment, so it's accessible, that there's comprehensive and mindful consultation, meeting the communication needs of people. And in terms of connected, that there's strong health literacy and early diagnosis, there's connection to the health system, as well as within the health system in maintaining quality care. I'm now going to hand over to my colleague Frey, who's going to talk a little bit about what this means for the roadmap going forward.
Thank you so much, Hannah. And Hannah just presented the elements of an inclusive health system as we took and as we heard it from people with disabilities. As we heard in the video, I know my body best and I know what my needs are. But what does that mean in practice? And how can we achieve this vision? That is why we are proposing a missing billion roadmap. And specifically, what this roadmap does is it provides a pathway to drive engagement from the global health community. And I'm excited to share that roadmap, that proposed roadmap with you now. The first question that we were asking ourselves is, what does this vision of an inclusive health, of an inclusive system or inclusive health means for health systems? In other words, what is vital on how health services need to be delivered? And if we think more upstream, what needs to be in place at the systems level? Starting with the service delivery. Firstly, people with disabilities make their own informed decisions about health. Second, people with disabilities can afford to access health services. Health workers are knowledgeable about disabilities and have the required skills. Healthcare services are accessible for people with disabilities, and it includes health facilities and infrastructure. And fifth, on the delivery side, rehabilitation and specialist services are available, affordable, and of good quality. Now, in order to achieve this, what needs to be true or what needs to be in place at the systems level? There need to be appropriate in-country laws and policies. Disability is articulated and represented in the Ministry of Health. Sufficient earmarked disability inclusion budget. And last, data showing the health situation of people with disabilities. That is what it means to take this vision to practice. Now, urgent action is needed, and I think we're all convinced by the data that Hannah presented. Urgent action is needed to achieve this vision and to transform health systems accordingly. So the missing billion is proposing, with involvement from experts, a set of minimum targets to coalesce stakeholders around the world. We believe that these are by no means the end all, but are a tool to set a direction and guide collective action that can further be expanded over time. The proposed 4 million targets aim to achieve the following by 2030. 1 million people with disabilities champion their rights to healthcare. 1 million additional people with disabilities in low and middle income countries have health insurance and or social protection. 1 million additional health workers are trained on disability. And 1 million health facilities are audited, and an additional 10,000 are inclusive. To contribute to these 4 million targets, we urge countries and governments to pledge for the following: disability inclusive national health plans, institutional leadership for disability inclusive health, a health budget line for disability, and disaggregated health data by disability. Now, everyone, and that means, and I'm sure it includes everyone on this call, can and should be involved in contributing to this and be part of this global movement. For instance, by pledging to close the mortality gap and achieve SDG 3, by advocating for health systems that expect, accept, and connect, by collaborating towards achieving the 4 million targets. Funders can mainstream disability in investments, for instance, by routinely requiring a focus on people with disabilities, or make targeted investments towards making health systems more inclusive to people with disabilities. Governments can assess national health plans, establish leadership within ministries of health for disabilities, or reaffirm or expand health benefits packages and financing schemes. And researchers and innovators can generate data, establish a global system to monitor progress and report on this, and obviously innovate where gaps emerge. Our call to action today is to join a global movement by committing to a common agenda and tangible goals. For instance, the proposed, such as the proposed 4 million targets. And we call for everyone to work with the Missing Billion initiatives and others in collaboration to achieve a common agenda and these goals. I think with this, we one more thing I want to mention is today is a moment where we're introducing the next Missing Billion report, including the dashboard and including an executive summary and short film, which are available on the Missing Billion website. The full report will be available on October 17th at the World Health Summit. So we'll make sure to also inform you when the full report is available to you all. But please do not hesitate to already visit the Missing Billion website to find the following information. And with that, it's my honor to introduce our esteemed panelists for today. And the first person that I would like to introduce is Dr. Joy Phumaphi. Dr. Phumaphi is not only a board member of CHAI, but also represents the African Leaders Malaria Alliance and is a former Minister of Health from Botswana. And Joy could not be with us today, but she kindly agreed to send us a message. So we're gonna hear from her now. So I'll hand over to put on the recording.
Thank you for inviting me to speak today. It has been 7 years since world leaders committed to the Sustainable Development Goals, including SDG 3, to ensure healthy lives and promote well-being for all at all ages. Agenda 2030 was set with the transformative promise to leave no one behind, yet that has not always been translated into practice. In fact, the reality has been rather far off, particularly for people living with disabilities. Only about 1/10 of people living with disabilities have access to the healthcare and assistive products that they need to learn, to work, or fully participate in society. COVID-19 only exacerbated these health inequities. In countries such as the UK, people with disabilities were disproportionately affected on a very significant scale. We mourn the lost opportunities and the lost dreams of people with disabilities and their families over the last 2 years. This new report from the Missing Billion Initiative highlights shocking gaps in healthcare access for people with disabilities. The data shows that people are facing challenges at every instance, from accessing prevention services and assistive devices to lack of rehabilitation care, as well as across communicable and non-communicable diseases. People with disabilities are less likely to get tested or get treatment for HIV. Women living with disabilities are less likely to be screened for cancer or secure sexual and reproductive health services. Infants and young children living with disabilities face greater threats to life, with higher rates of diarrhea, fever, and acute respiratory infection. Even when people can access the care and services they need, they are far more likely to face catastrophic health expenses. As a result, life expectancy for people living with disabilities is 10 to 20 years shorter than for those without disabilities. Their mortality rate is also 2.4 times that of people who do not have disabilities. We cannot shy away from these numbers and the women and children that are behind these numbers. This is a moral issue and an issue of human rights. All people have the right to healthcare and have the right to not be discriminated against in their access to care. However, we will not be able to meet the SDGs if we do not start developing programs and services for those most at risk of exclusion. Universal health coverage needs to be just that, universal. People living with disabilities should be expected, accepted, and connected within healthcare systems. There is growing momentum within the global health community, as well as individual governments, to make health inclusive. Inclusiveness needs to be central to all that we do as we reimagine our healthcare systems now and in the years to come. And thank you.
And in the meantime, I want to encourage everyone, if you have any questions, please do feel free to use the Q&A, and we will definitely do our best to respond to that. As our second panelist and speaker, representing the UN Partnership for the Rights of People with Disabilities and also a founding member of the Missing Billion Initiative, it's my pleasure to introduce Dr. Ola Abu Alghaib. Ola, the floor is yours.
Thank you so much. Thank you, Frederic. And thanks everyone for joining us today. I want first to congratulate the team for completing the report. It comes really on a very timely space that we are facing globally. As the previous colleague mentioned, it's not just the shock and unfortunate reality that we faced during the pandemic and we are still facing, with persons with disabilities being again missed from mainstream health response plans, mitigations, even recovery plans when it comes to persons with disabilities. We have also witnessed this year the high impact on persons on disabilities in Ukraine. And again, health systems and services, whether in country or neighboring countries, when it comes to emergency response, are still missing persons with disabilities. We witness at the UN Partnership of Persons with Disabilities that reality in more than 50 countries we're operating right now. Still, governments are looking at disability as a specific ad hoc service or a program that may entail, when it comes to addressing health, certain rehabilitation services, certain benefits that are barely connected to other sectors. Persons with disabilities are still, in many countries, even in low-income countries, are paying out of pocket for most of the services because it's not accessible to them. Health insurances are not well comprehensive to cover all the needs of persons with disabilities. So this is the reality. We are in 2022. We're years ahead after the convention was signed, almost halfway through the SDGs or even more, and still we're talking about inequality when it comes to persons with disabilities. And it is at the heart of discussions when it comes to health services, because it's so essential for the well-being, the independence of persons with disabilities, their abilities to function, earn an income, get education, all of that. If that is not guaranteed as a right, all the other rights are missed. And as I said, the struggle we see is also the interconnection, not just with other sectors and services, but also within the health system itself. And what we heard today in terms of the evidence is, unfortunately, to the disability community, is not shocking, but it should be shocking to other stakeholders who are ensuring in global commitments, strategic plans, that equity, addressing intersectionality, leaving no one behind is at the heart of all development and emergency work. But that is not the case. We need still more evidence. Missing Billion is a key initiative because it keeps reminding us and everybody there is something missed, and we can't keep missing it because we're talking about people losing their lives earlier than they should, suffering on a daily basis for complications of health, dependency on others because they don't have the proper services. And what was discussed today as a roadmap is something that we need all to take as a way forward, because it's not bringing something new. The building blocks of the health system are there for ages. Why are we not looking at them when we are addressing disability? So we can't afford constantly missing that. We are in agreement, I hope, that this is what needs to be done. And I hope once this report is also seen and accepted by other stakeholders, we will see more move towards tangible changes. As I said, when we support programs designed at country level, and our focus is, of course, changing national systems, policies, legal frameworks, health comes up as a priority. But unfortunately, we're not seeing all actors agreeing at national level that it is something that needs to be addressed now. Part of it is awareness as well. And I must say that even within the disability community, I know it's more tempting for the disability movement probably to push for more towards education, social protection. But for many of them, the daily struggle is accessing those basic needs. And the voice and the recognition of the importance and the role persons with disabilities, their representative organizations should play in reshaping the health system is very essential. And that's something shouldn't be missed, and it's very much missed in many cases. So what I'm hoping, as I said, from today's discussion, is that it is not going to stop here as another evidence that is informing us that there is something wrong, but it's really as an action for all relevant actors within their own spaces to start to look at what needs to be changed tomorrow. And hopefully next time we meet, it's really more of capturing more evidence on learning of what worked from the practices that we tried to promote in this report. And my final words would be saying, encouraging others to look deeply. Everyone has a role to play in this, and it can't be achieved unless we work all of it together. And as I said, hopefully in our next discussion, it's going to be more what is next from the first steps that were taken. And hopefully others will also realize the importance of constant systematic evidence generation and gathering. Without learning, without constant understanding, not just the impact on the lives and realities of persons with disabilities, but more on what has changed and what more needs to be done. Again, thank you everyone for being with us, and hope we will be engaging with you more soon in the future. Thank you, Frederic.
Thank you very much, Ola. Sure, giving us a lot of food for thought. I am honored to introduce our next panelist, a Paralympic gold medalist and representing the Foreign Commonwealth and Development Office of the United Kingdom, Susannah Rodgers. Susie, the floor is yours.
Thanks, Frederic. Thanks to Hannah and the team from the Missing Million for inviting me to speak to you today. And again, just to echo Ola's congratulations for the report. I'm very pleased to be joining you at this event, marking the launch of the much needed and important report on disability inclusive health in the coming weeks. So for those of you who don't know me on this call, and just to echo the introduction, I'm Susannah Rodgers. I was born missing the lower part of my left arm and leg, and with a malformation of my right leg and foot back in the 1980s, not giving away my age there, hopefully. During my mother's pregnancy, the scans in the hospital didn't pick up anything regarding my disability. And when I was born, it was quite a shock for both my parents to realize that I was missing some of my limbs. But my parents didn't dwell on this for too long, because my mum knew that I was equal to everyone else and that there should be no reason why I could not live an independent life of my own choice. So I've navigated the world as a woman with a disability, with some wonderful opportunities and moments, and the privilege of access to assistive technology and the healthcare that I need where I live in the UK. But I have also faced many very real and genuine barriers to equal participation in society, and have witnessed this for others with disabilities too, who I've met throughout my life so far. I'm a former Paralympic swimmer, and I competed for Paralympics GB at the London 2012 and Rio 2016 Paralympic Games, where I won gold and 6 bronze medals at both games. My career as a swimmer actually connected me even more deeply to the world of disability, because I'd spent most of my life trying to hide and blend into a non-disabled world in the majority. And it was after retiring from professional sport that I felt I should use my voice in a positive and impactful way, working on the rights of people with disabilities globally, and trying to pave the way for the empowerment of people with disabilities around the world, wherever they may live and whatever their background. I started working as a secondee at the UK government's Foreign, Commonwealth and Development Office on secondment from the NGO Seghers in 2020. I spent most of last year and this year working as a technical advisor on disability inclusion in the Global Health and COVID-19 Directorate of the FCDO. My focus was to ensure that we are considering people with disabilities in our global health work, and I was proud to be involved in the development of the Achieving Inclusive Health for All pillar of the Disability Inclusion and Rights Strategy from the UK government, which the FCDO published in February this year at the Global Disability Summit. Through my work at the FCDO, I have connected with many key actors and activists engaged in disability inclusive global health, including CSOs, academics, and people with disabilities themselves. It's through the secondment that I met the team behind the Missing Billion and their excellent work researching and building evidence on what works in disability inclusive health systems around the world. We know that access to quality health care is a human right and critical to ensure that everyone can live their life to the fullest. But as the pandemic has shown, this access is unequal around the world, especially for people with disabilities. This new report by the Missing Billion will not only highlight the need to include people with disabilities in health systems globally, but will also outline how to do this. And that's been demonstrated by the presentation by the team earlier, using practical examples and putting the individual at the heart of these systems. We know that the SDGs will not be achieved if we exclude people with disabilities, especially SDG 3, to ensure healthy lives and promote well-being for all. The FCDO in the UK has committed to ensuring people with disabilities are included in its global health work and will take forward these commitments up to 2030, building on the work started through my secondment. Without our health, we have nothing. It's important we take responsibility for our own health and well-being, of course, but where exclusion is occurring, we must do all we can to prevent this in the future and make sure that all people with disabilities everywhere have choice and control over their bodies and access to quality and inclusive healthcare throughout their lives. Thanks.
Thank you so much, Susie. Our final panelist, it's my honor to introduce, representing the German Federal Ministry for Economic Cooperation and Development, also known as BMZ. It's Dr. Bernhard Braune, and I think it's nice to be hearing from a former host of the Global Disability Summit to the upcoming host of the Global Disability Summit. So, Dr. Braune, the floor is yours.
Thank you so much, Frederic, and thank you, colleagues. And I'm very humbled to be in the presence of a gold medalist. Kudos, Susie. And yeah, give me the opportunity to defer my speaking notes just a little bit to put in one or two personal comments, because the numbers that presented in the report were already presented. And I mean, of course, it's important to highlight them once more. 15% of global population, 1 billion people. This is too important of a social and cultural and human value to ignore. And I think this needs to be underlined. It should be really stamped on all the documents up front. A second personal comment, as a person who does not have a disability as such, we can all be affected tomorrow. And I think this is why, you know, the inclusion of our health systems to people with all different needs and whatever they may be is such an important prerequisite for leaving no one behind. So this is not a lobby issue to some, but it's an important issue to all of us, because we can all be in that group tomorrow or the day after. And that's why it is so crucial that we design, and that's my third point, health systems that are open and inclusive. And that for the German Cooperation and Ministry of Economic Cooperation and Development is something that we try to advocate for, but we see in our own national system how difficult it is, and how much we need advocacy, and how much we need data, and how much we need to work outside of our constituencies to reach out for partnerships and to create alliances that teach not to the converted, but that really reach across society groups, that present new evidence, that create a new narrative that goes beyond what has been said in the last 15 years. I think this is really, really crucial, and we try to be partners in that endeavor and do our share. The personal remark I wanted to make is that both of my parents were working in a huge German institution for handicapped people. So I grew up among people with all sorts of physical but also mental disabilities. And I learned only when I moved to Berlin how that was unusual to be among people with all different talents and disabilities, and how in a regular city people are a little bit hidden away. And that's why I stumbled over the name of the report, Missing Billion, because people with disabilities are there. They are not missing, but they're missing often in our society and in our health systems. And that is definitely what we need to overcome. So inclusion is so crucial, and we really need to work on this missing part in the complex questions that we are addressing. Of course, I need to have a little advertisement for the German Development Cooperation. I asked colleagues, well, how do we address the issue? And there are a couple of country examples that I want to share with you in our development cooperation, working with local partners in Burundi. In our program on sexual and reproductive health, we have a special focus on inclusion for vulnerable populations. I was very touched by that example because this is, of course, as it is a difficult topic with huge complexity, and to include the vulnerability of people with disabilities makes it more harder, but even more important to do so. Also in Togo, when we work on health system strengthening, we have a special focus on people with disabilities. And we work with 7,500 key communities, community actors to include them. So there are large scale numbers and progress is possible if we really put a focus on that. And that's what I want to urge us all to do. Think in larger scale and larger volume. And lastly, Cambodia, where we worked on social protection systems. And there we also managed to discuss with our partners how to include people with vulnerability. So these three examples just should shed light on the fact that we are already working on it, and that we can achieve high numbers in our work if we are dedicated. And again, if we choose to work in partnerships and if we create alliances, and Germany and the Development Corporation of Germany is happy to do its part in it. So thank you.
Thank you so much, Dr. Braune. I think, Hannah, I'm happy to hand over to you.
Okay. So thank you so much, all the speakers. It was fascinating to hear these different perspectives, both professional and personal. And we're obviously all going to go out and practice our swimming now to be compete with Susie. And we have a number of questions in the Q&A which we can go through, and there's still time to put in a few more. So there's a couple that are about specifics about the report, which I can just answer quickly, but maybe can also have input from others. So we have two questions about data. So one is, in a way, what's the purpose, or what is the hope for impact of having data disaggregated by disability? And I suppose I'll answer that, but then turn to others, which is, if you cannot show that there is a health gap between people with and without disabilities, either in need or in access, then it's going to be very difficult to advocate or for people to act, to plan where to act, where the gaps are, and also then to monitor later to see if the gaps are getting smaller. So for instance, in our analyses, we found bigger gaps for some areas than others, and that would be where we would want people to start. There are, we don't have universal data at the moment. So what is in the data set now is mostly the mixed data, from UNICEF, which is a fantastic data source, but it's not yet available in all countries in the world. And we have the data from the systematic reviews on COVID and mortality. We are going to think about how to expand that with other data sources, and that might be a project in kind of years to come. So I'm going to put this question maybe in particular to Bernhard or Frey as to, do we think that this is a worthwhile endeavour to show data disaggregated by disability, or have we now sufficiently shown through everybody's work that there is a gap and that we should focus now just on interventions and actions? I don't know if either of you want to answer.
I can jump in if you allow. I think we can never have enough data, really. Once you start scratching on the surface of data and disaggregated data, and you see what you can get out of it, you want more. It's a little bit of an addiction, maybe. But as a person who's working at the interface of administration and politics, I would argue also for creating good political narratives out of data. So it's not about, reaching the scientists and the sociologists among us, but it's about reaching the political decision makers. And for that, you do need to create this narrative out of solid data. And I think too often we are working in one direction and missing a little bit out on the other. So I would advocate for both, continue to be working on good and solid data, and then also working upstream on developing a good, coherent political narrative out of it.
Thank you.
And perhaps, Hannah, if I may briefly add to that, I think in between is also an element of what data to generate indeed that will help contribute to that narrative, but also how data should be interpreted to guide policy decisions. What type of data are most critical? Because obviously we all know that data collection, data evidence generation, it's a significant effort, and so I think absolutely on all fronts there's continued effort and focus that's needed.
Thank you. So we've got two questions which are different questions about representation or inclusion of persons with disabilities. So the first, quickly to say that at our report launch, we certainly will include people with disabilities, and I believe there'll be sign language available, and that's very core to us. And the second is, the question is, what's the role of DPOs or OPDs in engaging the local governments? And I'm actually going to put this question to Susie, who's got the most experience here of working with OPDs and advocacy, and just your thoughts on that.
Sorry, could you repeat that question again?
So what role can DPOs or OPDs, whichever terminology you want to use, play in engaging with their local governments and getting them to focus on inclusive health?
Yeah, I mean, a huge role. So, we talk about meaningful participation and the importance of those voices. And I think for me personally, it's to see more people with disabilities working within government, and at least lobbying even governments to make sure, ministries of health and others, to make sure that they are including people with disabilities, but equally being at the kind of decision-making level. It's easier said than done. I feel like I was saying this, and it's a challenge, right? Because it's part and parcel with education, and within education there's inequality, so it makes it harder for people to get to that position of influence. But I think that's kind of our role really within this space. All of us working in this space is to champion those individuals and to mentor and encourage them to speak out and be part of the conversation, and be confident to do so, using lived experience. It doesn't necessarily mean that you need to be a technical expert. It's valuable to have that experience and talk to others within the disability community to gather that intelligence from other people with different impairments to your own, which is something I've been doing over the last sort of 10 years or so. So yeah, hopefully that answers the question, but yes, very important.
And just to add, I think that OPDs and DPOs have shied away sometimes of advocating for health because of the concerns about the medicalisation of disability. And what we've been trying to say through the Missing Billion is that people with disabilities have healthcare needs and that this is also a fundamental right. And so it's also finding a narrative that people are comfortable with in terms of talking about disability in relation to health. We are about to wrap up. I've got 2 more questions. So one to Susie, but maybe also to Bernhard, about your take on the kinds of proposed targets. So the health workers, the clinics, the champions, people with disabilities becoming champions. What's most important, do you think? What's an absolute must do? So maybe to finish both from Bernhard and Susie on that.
Who do you want to go first, Bernhard?
Susie,
or
why don't
me?
you go first, because the question.
Susie, go ahead.
Thanks, Bernhard. Yeah, so I would have said in answer to that, Phyllis, probably I would suggest empowering the individual, because that underpins everything really, in my view. If somebody has, well, knowledge is power. So if somebody has that knowledge, it gives them confidence, and then they can challenge about barriers within clinics, but also it gives them the confidence to, you know, speak to health workers as well. I mean, obviously everything is interconnected, so it's hard to put one over the other, but I would say that kind of knowledge is power leading to confidence piece is really key. And I'll hand over to Bernhard.
Thank you, Susie. Yeah, on the targets, it's so difficult to hit the right target, or to describe the right targets between being realistic and being ambitious. And to be very honest, I couldn't judge at the moment if the targets that you're setting are either one. But I would advise or advocate for being really ambitious. Yeah. Failure comes automatically, if you will, but ambition is so important, and being serious about our message, yeah, and making that point that it's about right, that it's about talent that we are missing if we don't include such a large group of our population. It's not about, you know, sympathy as such. It's about being smart in how we create our societies, about being economically and socially smart. And that's why ambition is so important in this report, and also in setting out targets. Also, you made rightly the point that it's about an integral part of achieving SDG 3. So I think we need to be making that connection with the targets. Is it, you know, and is it a realistic intermediary goal in view to reaching SDG 3 by 2030? Over.
So thank you. There's 2 great thoughts to end on. So the one is about empowering people, which leads to one of the final questions not asked about the building blocks, that yes, this is one of the fundamental building blocks, looking at people and communities to try and achieve these goals. And the second, I love what you said about ambition. And I think what the Missing Billion is trying to do is be a systems change initiative, and the ambition and the targets are set are for everybody, and to how we can align together and work together and make these really global goals that we all work towards and all try to achieve, because we all have the same ambition in our heart, which is that people with disability should not be dying younger. People with disability should have the healthcare access that they need, and that's what's fundamental be underneath the Missing Billion, both so that the Missing Billion on people are not missing from the health system, but also that we have a better world and an ability to achieve goals more broadly. So thank you again so much. Remember that the executive summary, the data, and the film on our website, and the full report will be launched on October the 17th. I thank again to all the speakers and to the funders, GIZ and FCDO, and for Chai in partnering on this really exciting project, which has been so much thought and love and heart for all of us. So thank you very much.